Question 1 is a ballot initiative which calls for limits on the number of patients assigned to one nurse at a time. It's backed by the Massachusetts Nursing Association, with representatives saying such a measure will ensure patient safety. But not everyone in the medical community agrees. Last night we heard from those in favor of question 1, and tonight we hear from those who are against it. And they say it would do more harm than good. Carolee McGrath sat down with CEO and Chief Nursing Officer at Holyoke Medical Center to find out why they're opposed to question 1.
We have ratios now. Our ratios range from anywhere from 1:1 to 1:6, depending on the unit, depending on the time of day, depending on the severity of the patients. This rigid limit is what really is an issue for hospitals like Holyoke Medical Center, small community hospitals especially, because we have very few resources to be able to pay for the additional nurses that we require. And frankly, from a patient safety standpoint, we don't see the need for it. There's really no need to say at night when patients are resting, to have a limit that is as strict as the 1:4 that's being proposed. It's really a law that could put Holyoke Hospital out of business, literally. I mean, it is financially unsustainable for Holyoke Hospital, and in addition to the fact that it's going to cost nearly $6 million that we can't afford, it will put patients at risk.
How will it put patients at risk? Because, of course, those who are in favor of it say that it won't, that it'll improve patient safety.
The way it's going to put patients at risk is that in 37 days or 40 days, we would all the hospitals in Massachusetts would have to ramp up and hire many nurses. I mean, alone for Holyoke Medical Center alone is 63 or 64 nurses that would have to hire, and there's a nursing shortage. We're already trying very hard to keep all our positions filled. It would be literally impossible to do that, and the wait there, the times and the backups in the ED would be significant.
And as a nurse, how would this impact your job? Because people might say, hey, listen, so the ratios that they're talking about is 1:1 in maternity, 1:4 in surgery. That makes sense for the layperson. But what would this mean, for you as a nurse?
Quite a bit. We have ratios already, so to speak. We have patient limits already, so to speak. And it's a complex decision-making process. There's no specific recipe that works. It depends on different scenarios on different days. And so to think about this being a ratio that's so strict and rigid and at all times without fail is difficult. From a chief nursing perspective, to staff for that and to make sure that there's coverage is a phenomenal challenge. There aren't banks of nurses that want to take per diem call just in case. People want a reliable paycheck and consistency, so those logistics are tough. And for the nurses at the bedside, I fear mostly about their autonomy and decision-making and professionalism being taken away, and I fear for the emergency department.
And talk a little bit about that, because you were talking about wait times and services, but what would that mean, for people?
So if I have to cap on the floors or on the inpatient side because there aren't enough nurses, we're at our maximum ratio, it all flows downhill. And that means that patients have to board in the emergency department. And we see that today a little bit with our ICU law that's already in effect. And to think about that being magnified to more areas is frightening. So patients boarding in the emergency department, it's loud, it's crowded, it's not therapeutic, families can't visit, and then the people in the waiting room, it backs up more and they can't be seen. And that's terrifying.
And let's talk a little bit about the numbers, because I know that there's a dispute about how much this would cost hospitals in Massachusetts. I know there was an initial report by the Coalition to Protect Patient Safety, which said $1.3 billion. And then those in favor of question 1 said, no, it might be more around, $50 million. And then there was a new report that just came out by the Health Commission that said it would be around 900,000. So what are we talking for numbers? Well, what's the real story?
The report that came out is putting a number at 950 million, 949 million, not thousand. I just want to make sure.
Yes.
Yeah, and really, essentially, it validates what the Coalition to Protect Patient Safety has been saying all along, what the MHA has been saying, what the hospitals have been saying, which is it's a very, very costly bill, and we don't quite understand where that very low number of 50 million comes from. I mean, for Holyoke Medical Center alone, which is a small community hospital, the number is 6 million. So it can't possibly be that low. And I think now we have validation by an independent agency that says that it's going to cost nearly $1 billion to implement.
And do you think people realize that? Because, on its face, it seems like, hey, this is a great idea. You know, we're going to make sure that patients are safe, that there's plenty of people surrounding them, you know, giving them those wraparound services when they're in the hospital. And it sounds like this is the right move. How do you convince voters who are going to go out there and try to make this decision that this is not going to make things better for them?
I think it's important for voters to tune in like they are today and to hear the different sides. I think it's important for people to read the language. And I think it's important for people to think about what it means for them. And that healthcare cost that's being quoted as the close to $1 billion is going to translate to payers and the community. So that's one thing. More importantly, though, I think it's really important for folks to understand that their access to care will be limited. There will be wait times in emergency departments, and that unknown diagnosis is risky, and boy, that hits home. That's what I think it means to the public that's most important.
And for the small community hospitals in particular, what are you hearing from other hospitals in Western Massachusetts?
The impact is essentially the same across the state. It's just on a bigger scale if you're a bigger hospital, but sometimes, you know, bigger systems can absorb cost a lot easier. For community hospitals, it literally is a dire situation. I mean, our bottom line last year was much smaller than the number, the $6 million that it's going to cost us to implement this. So I think it's dire across the state. And
what services, like, I mean, off the top of your head, you know, would be gone if this went into effect, right? Because you said it's a pretty quick turnaround if it went into effect that you would have to make those adjustments.
Well, in fairness to, you know, to folks that are watching and our patients, you know, I wouldn't want to put out, you know, specific services that we may have to scale back, because it's not fair to have these discussions before we know if we have to. But the reality is we can't continue to do everything we do today and come up with $6 million. So at some point we'll have to decide what else we need to eliminate or cut back in order to pay for this bill. So and at a time when Holyoke Medical Center has done a lot of work in the last 5 years to grow services and provide more services to the community, it would be very unfortunate to have to cut back.